Welcome back to Medinare. Let's discuss this MCQ. Aneuploidy not seen in. The options are Down syndrome, Turner syndrome, ectodermal dysplasia, and Patau syndrome. To answer this question, we must understand what is aneuploidy. For that, now we need to know what is aneuploidy. Aneuploidy refers to presence of abnormal number of chromosomes. Usually humans will have 46 chromosomes, right? If it becomes 45 or 47, if one chromosome get reduced or added, it becomes abnormal, right? And that is termed as aneuploidy. We have types of aneuploidies. Let's discuss what are they. Let's start with monosomy. From the name itself, you can say that it is mono, right? So in monosomy, only one chromosomal allele will be present. Only one chromosomal allele will be present. One common best example for this will be Turner syndrome. In Turner syndrome, there will be 45X chromosome. There will be absence of one sex chromosome. Next, we have disomy. In disomy, there will be two copies of a chromosome. This is normal. There is nothing abnormal with this. This is usually seen in all human beings. So this is normal. The next type is trisomy. In trisomy, there will be presence of three copies of chromosomes. Normally, there will be two. If one gets reduced, we call it monosomy. If one gets added, we call it trisomy. Examples of trisomy is Down syndrome. It is trisomy 21. The next example is Edwards syndrome. It is trisomy 18. Next example is Patau syndrome. It is trisomy 13. So, what is aneuploidy? Aneuploidy is abnormal number of chromosomes in a human cell. Usually, human cell will have 46 chromosomes. If either it gets reduced or increased, it becomes abnormal, and that is termed as aneuploidy. The types are monosomy, disomy, and trisomy. Disomy is normal, where there are two copies of a chromosome. Whereas, when one gets reduced, there will be one chromosomal allele as in Turner syndrome, and if one gets added, there will be three copies of chromosome as in Down syndrome, Edwards syndrome, and Patau syndrome. With this, now let's get back to the question. Aneuploidy is not seen in. Down syndrome is 21. Turner syndrome is 45X. There be absence of one sex chromosome. And Patau syndrome is trisomy 13. So the answer is ectodermal dysplasia. Aneuploidy is not seen in ectodermal dysplasia.